Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Differences in Risk Factors for Suicide Attempts Among 9th and 11th Grade Youth. The authors wanted to find out if the risk factors for suicide attempts change as adolescents get older. They used 3,300 9th and 11th graders from the AdHealth longitudinal study. The authors found that depression was a common risk factor for suicide attempts for both 9th and 11th graders. In addition, girls were at higher risk for suicide attempts, as were those adolescents who were on public assistance. However, the authors did find some risk factors that differed based on the adolescent's age. 9th graders were more at risk for suicide attempts if they used illegal drugs, had a homosexual orientation, or had early or late physical development. Most of these risk factors diminished as adolescents entered 11th grade. However, 11th graders were more at risk for suicide attempts if they experienced sexual abuse, were receiving counseling, or were of Asian or Native American ethnicity. The takeaway is that depression is a common risk factor for suicide throughout adolescence. This means that screening for depression in middle school and high school is a good step in getting adolescents the help they need before they resort to a suicide attempt. In addition, teachers and counselors should be aware that other risk factors for suicide change as adolescents get older. This reflects the need for taking developmental factors into consideration when looking at suicide risk. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.